P. I know you are the head of gastroenterology and hepatology at the medical center. Another area that you specialize in is liver disease. Is liver disease a growing problem in this country? D. Yes, it is, for two major reasons. One is the hepatitis C epidemic, that is now reaching a stage where many patients who developed this disease 15, 20, 30 years ago have developed advanced liver disease or cirrhosis, and many of those folks will develop liver cancer, so that is a major problem. The other thing that is happening is with the increasing problem with obesity in the United States, we see more and more patients with fatty liver, which causes issues as well. P. Okay, well, we can talk about both of those. Tell me, though, what does the liver do? What is its purpose? D. The liver does a lot. It is important in terms of metabolizing the nutrients that we eat in our diet. In terms of detoxifying things that you eat, it also helps clear infectious agents, bacteria, and so on from the bloodstream. It makes a lot of proteins that are important to blood clotting, to how our bloodstream works, and I can go on and on. And the bottom line is that you can't live without your liver. P. You can't live without your liver. Sure. Somehow I knew you were going to say that, but and also, it was unusual in that if you take a piece of the liver away, it will grow back. D. Yes, the liver does regenerate, and that has actually been of a very important clinical use, because now we have a situation regarding organ transplantation where we can actually take a piece of a donor's liver, a living donor, and give that to somebody whose own liver has failed, and if you follow both of those people, that is the donor and the recipient, within about 6 months, both of those pieces of liver will have regenerated to their original size, and that is a remarkable thing that has been very helpful in liver transplantation. M. It certainly is. Let me ask you about hepatitis. There are 3 different types, right? D. Hepatitis only means inflammation of the liver. So, in terms of viral hepatitis, there are more than 3, but the big 3 that we worry about in our country are hepatitis A, hepatitis B, and hepatitis C. Those are the big ones. M. What are the differences in terms of how that viral infection is transmitted, and what the prognosis is, or how serious it can be? P. Well, the route of transmission for A is different from that for B and C. You get hepatitis A by usually eating contaminated food. Somebody who's handled the food hasn't washed their hands appropriately, and you ingest those hepatitis A viruses, and that is how you are infected. For hepatitis B and hepatitis C, it usually has to be an infection through the bloodstream. So in the past, before we were able to appropriately screen blood products, transfusion was a common way of getting those infections. No longer, at least in our country. The other is intravenous drug abuse, another way of getting hepatitis B or hepatitis C.